Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained. This is episode number 136. I'm your host, Marie Betcher, RN. Today I'm interviewing a returning guest, Jamie Haberman, RN. Jamie is a dedicated Christian wife, mother of 6, homeschool teacher, hospice nurse, international best-selling author, entrepreneur, owner of Hospice Buddy. Jamie is a RN. She does triage for a hospice company, and she also has her own business called Hospice Buddy. I invited Jamie back today because I really want to dive deep into a subject that's not easy. When hospice doesn't go well, I read posts online, and you always can hear somebody say, hey, this didn't go well, that didn't go well, because sometimes it's our expectations of what and how it should go. And maybe they weren't the realistic expectations. And sometimes it's just personalities, or the hospice agency doesn't have all of what we desired, So we want to address some of these subjects and welcome Jamie.
Thank you for having me. It's good to be back.
Tell us what you're up to. Hospice Buddy still going well?
Hospice Buddy is going great. I am working with a few different clients, and they are all over the country. And I've had one person that I've been talking to for well over a year. So I'm actually really proud of that and very thankful that I've made that connection. And it is exactly my goal, is just to be there for people throughout this process and past the passing of their loved ones, to help them kind of navigate those new waters and how to pick up the pieces and move on. So it's been great.
Good. Very good. Well, and Jamie is a perfect example of somebody who can tell us Jamie's still currently working in hospice, takes those after hours calls when family members are in the greatest need and need to reach out to, what do you want to call it, a lifeline? Like that one television game show, you had a lifeline. Jamie's a lifeline. So, Jamie, what's the first part? I think we should actually let's start with unmet expectations and what's realistic and what's not. Do you have some thoughts on that subject for a hospice company?
I do. And so, when people sign up for hospice, I think most people who aren't experienced in it already have an expectation that when somebody signs up for hospice, they go somewhere, or that when they sign up, they're going to have a nurse 24/7. And unfortunately, that is not the case, and that is not the normal process of how things go. And so when somebody signs up for hospice, the majority of that care does fall on the family or the caregiver, whoever you have in your life that's going to help you through that problem. And hospice comes in, and they do make routine visits, and they have on-call visits, but we don't have people to staff somebody's home 24/7. And I think that causes a lot of confusion and upset in a lot of the calls that we get when people are upset, that they think that hospice should be doing more than what they're getting.
Oh, that makes sense. And hospice definitely doesn't take over. And hospice is there to guide you and assist, but you are your family's caregiver. There can be some backup, but most often they're paid for. You have to pay for caregiving, and caregiving is big. I mean, if your loved one goes on for months and months, a lot of people need to return to jobs, and they have to figure out, what can we do? So, and hospice is not the caregiver. So that's definitely a piece to be realistic, that you need to be planning this and discuss it with hospice, right? Have the discussion.
Right.
How can you help me?
Right. And when you are going through this, I think we definitely understand the frustration, the fatigue, and all of the things that come with caregiving and how taxing that can be. Not only is it scary because you don't know, what's coming next, or you don't understand what your loved one is going through, but feel a little bit unsupported in those moments, which is great that we have, the ability to call in and talk to the nurse. But when you're alone one-on-one with that loved one going through symptoms, it can be a little daunting and scary. And I think it's our job as triage and as hospice to help calm the waters and provide education and send a nurse if needed to help manage symptoms. But again, the expectation is that families or paid caregivers are the ones to provide that 24/7 care.
I agree 100%. The families or a paid caregiver, or for example, if the patient was at an adult family home, a nursing home example, they're the caregivers and hospice is the support and the backup.
Right. And we do have the hospice houses or the hospice care centers, or whatever they're called, um, by that company. But these care centers are meant for short-term stays for a symptom. That is their primary um, goal, is to get people's symptom under control, and then the goal is to go back home. They do have respite stays where you can go for up to 5 days and just get a break from your caregiving duties to focus on yourself and your own appointments and your own mental health. But again, the goal is to go back home. And if they need routine care in a hospice care center, that often comes at a cost, much like paying for room and board at a nursing home, if not more.
Makes sense. When we hear about respite, I want people to understand how often they could utilize respite. What's traditional?
So they can have it once a benefit period, and there are times where we can make exceptions if there's something serious going on. But for example, if I took a call that the patient's spouse fell and hurt their knee and they had to go to the emergency room, and the patient was not able to be alone by themselves, didn't have any other family around or anybody to help care for them, and we didn't know, if that spouse was going to be admitted or, when they would be back home, we could do emergency respites in those cases where they can go to the hospice house until we come up with a discharge plan, and we know what's going on with that caregiver to get them back home. And if it looks like they're not going to be coming home anytime soon, we might have to start talking about placement, and where we're going to go from there. So there's a lot of social work involvement and team involvement and family involvement to help navigate those issues and help come up with the best solutions when those things are happening.
That makes sense. Yeah. A benefit period for the beginning is 90 days. So they could have one respite in that 90 days and then again in the following 60 days. So, in essence, they could have 2 5-day respites for a total of 5 months. But that is not guaranteed that there's always placement for the respite. Would that be something to say?
Yeah, definitely. So that those respite stays are definitely based on bed availability, because if their care center is filled with patients that are having immediate symptoms that need to be controlled, they might not have a bed available. Many places have contracts with hospitals and might have multiple hospice care centers. So they may have to go to one that's maybe a little bit farther, maybe not as convenient. We do try to help as much as we can, but sometimes there is just not a bed. So it definitely can be frustrating. And they usually don't find out until the day of that, yes, there is a bed available and everything's okay to proceed.
Right. So something that's available doesn't mean it's going to be available the day and hour and moment you need it, just to manage expectations. So, on the lines of managing expectations, I think it's good to start when you sign up for hospice. And in my show notes, I always have how to find a local hospice, and there's a link, and you can compare hospices in your area. So you can find out this one is a profit, this one's a for-profit hospice, this one's a nonprofit. This one offers, for example, they offer music or massage therapy, some additional services. The other one is basics. They offer chaplain, social work, nursing, and bath aids. Whereas the one with massage offers all the rest plus the additional services. So you can compare before you even pick a hospice. Any thoughts on that, Jamie?
I think it's good, and depending on where you live, there may be multiple hospices to choose from, or the hospice that I had just worked for, they were the only one in the area. There was not another option. So there may be times where you're very limited on your options, but definitely if you have the option to look around and shop around and look for those services that would be beneficial, like art therapy or music or pet therapy, if they have those available. It's definitely worth checking out. And you can also look online at reviews, which can be really helpful.
Absolutely. Well, so if somebody's chosen a hospice, somebody's, their loved one's doing maybe a little better than expected, and they're going to last a little bit longer on hospice because a lot of folks don't last a week. That's pretty common. What would you say the average is these days, Jamie?
I want to say you're probably not far off. People do sign on and they pass quickly afterwards. And I think part of that is due to, wanting to keep trying different treatments until it's no longer an option. And by the time it's no longer an option, it's because they can't get out of bed anymore. They're not eating, they're losing weight. And the doctor has finally said, okay, we're out of options. And so people do end up signing on really late and passing shortly after. We do have patients that die during the admission process. And then we have patients that, last that full 3 months or 6 months. And then, they need to be discharged because they're not declining fast enough. So it really depends on what's going on. But I would say the average length of stay, I haven't looked it up recently, but I want to say it's like 16 days.
So that's even more improved than what I was thinking. So when you think about 16 days, that's not a lot of time. It's not a lot of time for many pieces of this moving puzzle. But what if you're not happy? What if you just don't click with somebody? What if you don't click with the nurse? What if you don't click with the social worker? Jamie, what are somebody's options as a patient?
I think that it's important to first try to have that conversation with that staff member. I know that it can be uncomfortable, but trying to have an honest conversation about what your expectations are, what you're not happy with, and how to improve it. If you feel that's not an option or you've tried and that's not working, I always suggest to get in touch with the manager of that team or the administrator that's on call to talk to them about it, because oftentimes it can be reassigned to a different nurse, but there are times where that nurse is the only one in that specific area. So it really depends, but definitely raising your concerns to the management and letting them know, like, we're not getting along, we're not seeing eye to eye, and I'd like to have a different nurse, is your right to do so. We're not always going to get along with everybody. That's just our nature, and that's okay.
Yeah, it is okay. Not everybody gets along with everybody. Sometimes, and what Jamie's encouraging someone to have is a hard conversation. And that might be that place where you both realize we are talking about the same thing. We just were saying it differently. So maybe there would be a way to work with this particular staff member for sure.
Right. And I know it can be uncomfortable, especially if you're one of those non confrontational people who doesn't like to stir the waters. But at the same time, you know you're advocating for your loved one or yourself, and you deserve great care. And that's what we aim to provide.
Absolutely. And I think one thing that unfortunately we have to realize that the person is going to be losing a loved one. And it really, you don't want that to cloud your memories, to make grief worse. We want to make sure you're thinking about this so that you don't come out aggressive, be assertive, but not aggressive, be kind, not mean. There's lots of ways to approach conversation, but it's okay to approach it. It's definitely okay. And you could even ask for the social worker to come in so you and the social worker could talk to the nurse. So you could say, hey, I have concerns, or, vice versa, so that somebody that knows the nurse and that knows you, and then
A resolution in there. Right.
resolution. Why did I not think of that? Yes, exactly, Jamie. A resolution. What what about changing hospices? Like you said, that could be the only one. What are somebody's options?
So if it's not the only one, you're more than welcome to call the other hospice and ask for them to come to assess. And it's really just a matter of paperwork, and they can do a hospice to hospice transfer. And we would make sure that we're sending the other hospice the medical records that they need and the documentation they need to proceed. But it's really just a matter of signing a form to get that going. And you don't necessarily have to talk to your hospice beforehand. It is nice to let them know what's going on and what your plans are. But if you feel that your issue cannot be resolved and you're unhappy with the care, you're more than free to revoke services or to switch hospices.
Right. And I haven't talked about revoking in a while on the show. So why don't you go ahead and re-explain what a revoke is, please?
Sure. So if somebody, say they're at home and their primary diagnosis is cancer, but now they're having chest pain and they really want to go in and go to the ER and get this looked at. Maybe they had a heart attack and now they have to go through a cardiac cath, or some sort of invasive treatment that is not focused on keeping you home and keeping you comfortable. So if you want to pursue further treatment on issues, then you can sign a revocation form, and that would end your hospice benefit. And then you can pursue those treatment avenues that you want to do. And then you can always sign back up. There's no limit to how many times you can sign off and sign on. You can do that at any time. When you sign back up, you would just sign into the next benefit period, which I think should be a whole nother conversation, but it's definitely doable. If you want to pursue treatment on something, you have that right to do so.
Yes, that's true. And there is lots, if you want to look it up online, audience, patients' rights on hospice. There is a huge list of patient rights. And this was created for your safety and your loved one's safety, for getting the care you deserve at end of life. Jamie, thank you so much for part one. I so appreciate you coming back to Hospice Explained. You can reach Jamie at Hospice Buddy.
Just hospicebuddy.com.
Okay, perfect. And Jamie, give us a little reprisal what Hospice Buddy can do for a client.
So my goal with Hospice Buddy is just to be there for people. I know that this is a very trying time in their lives. It's arguably one of the most difficult things that you are going to go through, and it's very emotional, and things can change from day to day. And so having somebody to lean on that you can relate to and feel comfortable talking to about anything or the things that are going on, that can kind of ground you during this process is really important. So that is my goal with Hospice Buddy, is just to be a constant support for those that need it. and to provide education and information regarding hospice.
That's perfect. Wonderful. Thank you so much, Jamie. And I will have Jamie on part 2, which will follow up next week. Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.